It seems like many of the issues that arise when gender identity doesn't align with sex assigned at birth are problems of societal acceptance rather than inherent problems in the transgender child. So many people wonder whether a medical diagnosis is necessary at all.
I think some of the controversy is this really a disorder, or is it only a disorder because it's socially unacceptable to certain people? And it's really the pressure of not being accepted as a person whose body looks one way and feels differently. So is that really a disorder, or is that a societal problem, I guess, is really, when you think about it, that could be part of the issue.
But since transgender individuals may need to access ongoing medical care, including, for example, access to cross-sex hormones and specialist care, at present, a formal diagnosis is necessary to facilitate access to that medical care. The question about what that diagnosis should be has spurred many years of debate in the medical community.
Unfortunately, right now with healthcare and getting things covered for insurance, if you go to a doctor for anything, you need to have some type of a diagnosis so that the medical plan and the treatment plan gets covered by the insurance.
In the 1990s, the fourth edition of the Diagnostic and Statistical Manual, or the DSM, used by psychiatrists to make psychiatric diagnoses, offered transgender children a diagnosis called gender identity disorder. Many people in the transgender community took offense to this terminology because it suggested that something was fundamentally wrong with the very identity of a transgender individual. In the next version of the DSM, the diagnosis was changed to gender dysphoria, terminology that shifted the focus from identity to the distress experienced by many transgender individuals, which can arise from body discordance as well as societal difficulties associated with the stigma of being transgender. The term gender dysphoria has also been criticized by those who argue that there are transgender individuals who don't feel distressed by their cross-gender identification, and so the search for an appropriate classification continues.
Even with dysphoria, it makes it seem like there's something wrong with the person mentally. So the next, I think, revision hopefully will also get rid of that term dysphoria and may just be being transgender or gender nonconforming.
It's almost like we're using the diagnosis specifically to access pieces of care that are gender affirming for your child. And that's what I would want a parent to know.
Today, many people in our society, including medical professionals, look back with shame and regret at the fact that until 1973, gay people were labeled with a psychiatric diagnosis. Perhaps in the future, we'll look back with similar regret at having used a psychiatric diagnosis to characterize an entire group of children just because their gender identity didn't match the sex they were assigned at birth.